Good afternoon, dear doctors. Can you all hear me?
Yes, we can.
Okay, thank you so
Dr.
much.
Ritu.
So good afternoon, dear doctors. Wish you all a happy World Diabetes Day, which we have been talking about since so many days. But we forgot that we celebrate Children's Day too in India. So happy Children's Day to the child within us. With this note, I, on behalf of Homeopathy Middle East, would like to welcome everyone who's part of us today in growing numbers to mark this special day. Especially Dr. Eddie Thielens, who could take out time out of his busy schedule to share his expertise to enhance our knowledge, which is one of the sole mission of Homeopathy Middle East. We are extremely delighted to have Dr. Ihab's principal, who would be unfolding the real Dr. Ihab. Please don't take it literally. We welcome our surprise special guest for the evening, Professor Dr. F.F. Motiwala, MD Homeopathy, Principal of Motiwal Homeopathic Medical College and Hospital, Nasik, India, on this platform. Looking forward to a great learning event. Thank you. With this, I hand over the platform to Dr. Kamal. Dr. Kamal, I would like to have you on this platform.
Yeah,
Are you
thank
there?
you, Dr. Ritu. Yeah, I'm there.
Your
Can you hear
videos
me?
off you and you're muted. You're muted and your videos off.
No,
You can see me? It's on.
Yeah.
Can you hear me?
yes, you are absolutely
Okay.
clear.
Thank you, Dr. Ritu. Good afternoon, everyone, and a very warm welcome to Dr. Eddie Thielens, Professor Dr. F.F. Motiwala, Dr. Manjari Rao, and all the participants of today's webinar. As we all know, today is World Diabetes Day, which is marked every year on the 14th of November, as it marks the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. Additionally, this is an extremely significant day created by the World Health Organization in response to the growing concerns about the escalating health threat posed by diabetes, which is an important disease and it should not be overlooked. Because even with multiple warning signs that come early, many don't seem to pay heed to this. So on this day, it is very crucial for all of us as individuals and all of us as doctors to understand and acknowledge this in our patients as well as our family, and pay attention to the silent symptoms that come almost decades before the disease manifests completely. Due to this, I believe that it is very important to understand how we can tackle it best from the homeopathic perspective. So let's head into the session today on the miasmatic approach in treatment of diabetes and other chronic illnesses, which I'm sure we're all excited to gain a comprehensive insight from. On that note, I would like to invite our moderator for today, my very own friend, Dr. Manjari Rao, the first homeopath friend I made in Dubai. Her excellence has been attained through a dedication of many years. She has studied homeopathy at the Yella Homeopathic Medical College and Research Center. And interestingly, after she graduated from the University of Bombay, she came to Dubai on a visit visa, appeared for her exams, got her license, and then got a residence visa and started to work. She has over 14 years of experience practicing classical homeopathy through continuous studying and reading lots of works done by masters and by attending webinars too. She's also a certified personal counselor and even holds a special interest in nutrition and lifestyle management. She's currently with the Elixir Clinic, Dubai. Welcome, Dr. Manjari, and over to you.
Thank you so much, Dr. Kamal, for the lovely warm welcome. And it is an absolute honor, a sheer privilege that I have today to introduce a senior homeopath, a teacher, and a passionate homeopath par excellence, Dr. Eddie Thielens. This year, Dr. Eddie turned 70 in June, on the 2nd of June. And before, of course, he's had an illustrious career in practical medicine, and at the turn of events made him practice homeopathy. He graduated cum laude at the Catholic University of Leuven, Belgium as a medical doctor, and he did his co-internship for 1 year at the same university hospital. He started his general practice in Diest in 1977 and gradually converted to homeopathy in 1990. He specialized for 2 years in geriatrics at the University of Leuven. He graduated from this specialization cum laude in July 1990. He started his first year training in classical homeopathy at the Flemish School for Unitary Homeopathy in Ghent, Belgium. He graduated in 1994 at the International School for Classical Homeopathy at Hechtel, Belgium, after 3 years training with the late Alphonse Gukens, an absolute master homeopath himself. He taught and supervised at the same school for many years. And he was also invited by another great teacher, George Vitulkas, in 1997 to teach at his School of Alonissos, what is now the International Academy of Classical Homeopathy, from 1997 till 2000. After this, for many years, he hosted educational seminars and taught in Malta, Sweden, Germany, Holland, Belgium, Israel, Bulgaria. And then he was invited by Dr. Vera Sanina to teach in her school at Moscow. And that's where the whole Moscow session of his life begins. Teaching in Moscow remains his absolute passionate experience. And as a result of that, we have Dr. Anna from Moscow, who has joined us, who's a co-collaborator in almost all webinars. And she does the hard work of curating all his slides and his PowerPoint presentations. So for us to have an absolutely enriching experience of studying homeopathy. So on this note, Dr. Eddie, I invite you on this platform of Homeopathy Middle East to join us and share with us your experiences in treating chronic diseases with the lens of miasmatic management. Welcome. Dr. Eddie, you'll have to unmute yourself. Somebody will have to unmute him otherwise.
It's okay now?
Yeah, that's fine. I think it's muted again. I tried to unmute you, Dr. Eddie.
Yes.
I'm
Now
trying. Yeah,
yes.
It's fine.
Okay, I can start.
Yes, absolutely clear. You can go
Thank
ahead.
you very much. So, first of all, Dr. Manjari, I'm very grateful to you for organizing this session with all you. And I'm very honored and I'm very happy to be with you to talk to you, my dear colleagues. And I'm going to try to give you a little of my little experience today concerning miasmas in homeopathy. So if we look at homeopathy, there are a few very important aspects we almost must respect. First of all, there is observational facts, not theories, not hypotheses, facts. That's the first thing, observation of facts, like Hahnemann said, facta non verba, facts, no words, he said. The second aspect is the principle of inductive medicine, induction. It means that we go from very clear objective facts and we produce out of this some kind of laws we have to respect in homeopathy. So from induction means we start with facts and we end in certain laws, not dogmas, but laws. And we know a few laws in homeopathy, the law of Herring, whatever. So this is the strict inductive method. And we almost must respect the strict inductive method. Because Dr. Herring once said, if we ever stop respecting the inductive system of Hahnemann, homeopathy will become nothing but a caricature in the history of medicine. So induction is very important. And because of this induction from facts to laws, we see that there are also very important general states in homeopathy we must respect. We all know that homeopathy is the science of individuality, of idiosyncrasy, but experience brings us also into general states we must respect because of induction. And then the third aspect, very important aspect in homeopathy, is verification of symptoms. So observation, induction, and verification. Verification of symptoms is in fact what we can call research in homeopathy. going to give you an example just about the remedy Spigelia. So I found a few years ago that diverticulitis of the sigmoid very often responds successfully to Spigelia. So you can say, yes, but you're treating a disease. Yes, in fact, we are still respecting the individuality of the patient, but very often we come to some what I call the common places, which are not so usual in homeopathy, which seem to be unusual. So I found out that in Spigelia very often is the remedy for that diverticulitis. And thanks to the repertory of your very famous master Fatak, I found it. Because a lot of people with diverticulitis have problems in the act of sitting down. So, and this is to be found in the repertory of Fatak, and we find Spigelia there. So I could help quite a few diverticulitis patients with Spigelia. So these are in fact things that must make us think not only in an individual way, but also more in a commonplace way. So then I found out about Spigelia in the literature that Dr. Allen did quite a lot of provings with Spigelia, and some of these provings had to be stopped because of a very terrible pain into the sigmoid. You see the correlation immediately. And then afterwards also, there was another homeopath, I forgot his name, who lived during the time of Kant. He also used Spigelia as a palliative remedy in rectal and anal cancer. So, in fact, if we can find something like this, this is in fact verification of the symptom, or verification of the remedy, Spigelia. So this is what I call research. And I was very happy to find in the literature my confirmation. So I do not say, or I do not claim that every diverticulitis patient will be cured with Spigelia, but it's really worthwhile to think of it in those cases. If there are other symptoms, okay, there is another remedy probably. But do not forget, that's what I want to say about verification. Do not forget Spigelia in diverticulitis of the sigmoid. And we all know that, in fact, due to the paragraph 205 from the organon, we know that we as homeopaths have the advantage to treat diseases before they materialize. That's nothing. In allopathy, they wait until there is a materialization of disease. So I give you an example. A person can complain for 5-6 years for pain in the stomach, and endoscopically it's negative, nothing is to be found, but he still has pain. And then after 5 years, he develops an ulcus, malignant or benign, whatever. So in that period of functional stage of disease, we can already do something, and we can already help the patient. And this is not to be done. This cannot be done by allopathy. This can only be done by homeopathy. And that's why Hahnemann, in paragraph 205 of the organon, he talks about the fact that we should rather treat miasmas instead of diseases. So miasma, how can we make a definition of miasma? Well, it is not so easy, but I always like the definition of Dr. Allen, who says a miasma, in fact, is every influence on the organism, be it hereditary, be it acquired, every influence that makes an organism more susceptible to disease. That is, in fact, the definition of miasma. And we should be careful. We should not confuse a miasma with a disease. I'm going to explain you. The tubercular miasma is not the disease tuberculosis. The disease tuberculosis is wonderfully treated by allopathic medicines, by tuberculostatica, but the tubercular miasma, they can do nothing with their tuberculostatica on this miasma. We can in homeopathy, but they cannot. So they can do a lot about the disease, but they're not able with allopathic medicine to do something about the tubercular miasma. And we do. Certainly we do. I will show you. Another example that miasmas can be so important is, for instance, let's take a woman with a few cancers in the family, with a kind of cancerous diathesis in the family. she marries a man who had in the past quite a few SOAs, quite a few sexual transmitted diseases. Well, that woman, after marriage with that man, first of all, is more susceptible to contract cancer than other women. That's the first thing. And if she, the second important thing, if she does, in this situation, the prognosis will be more, bad prognosis, because we see that there is a mix of miasmas. There is a psychotic miasma from the patient, from the partner of the woman, that is mixed with her hereditary diathesis of cancer. You see the mixture of miasmas, and that is what Hahnemann talks about in paragraph 40 in the Organon. The most miasmas are mixed. We seldom find a pure psoric, or we do, but not so often, we find a pure tubercular, a pure psychotic. Very often the miasmas are mixed. We talk about a pseudo-tubercular patient or a psychosyphilitic patient or whatever. And that makes our job not easy. And for this, we can look at paragraph 40 in the Organon, especially the footnote. Very often we have in one organism different miasmas active. And we should indeed, first of all, treat the most active, the most prominent, most predominant miasma, but sometimes we have to take care of many active miasmas at the same time. And that makes our cases quite difficult, but very interesting. We can also say that how do we have to look at a patient? Well, in my opinion, we have to look at the patient in the following way. How is a patient trying to get rid of his toxins now and in his past? So that's also the reason why the biography of the patient can be very important. If we see in the past that a patient uses a certain pattern of elimination of toxins, very often he uses it now at the moment he's sitting in front of you also. So that pattern we must try to find. How, and then we must try to help him. How is a patient able to get rid of his toxins? How can we help him with this? And this problem goes over generations. We also have to look at the parents, at the grandparents and so on, and we have to look for certain patterns, because we all know about aggravation of remedies. First of all, an aggravation, in my opinion, has very little to do with potency or whatever. An aggravation means that probably the remedy you prescribed was a correct remedy, but the timing was not so correct, meaning you prescribed the correct remedy, but was the organism able to use this correct remedy to get rid of his eliminations of toxins? Was he able, for instance, to get rid of his toxins? For instance, you can give sulfur to a wonderful sulfur constitution. You say, this is all sulfur, and the patient is constipated. Well, you will have problems. You will have problems. Unless, for instance, you can help him with a few doses of nux vomica. So his constipation goes away, and then he can get rid of his toxins. We have to make channels open in homeopathy. And that is why often there is not only a need of one remedy, but there are a few helping remedies necessary to use in homeopathy. And that's why we also, we know the importance of complementary remedies, of antidotal remedies and so on. So the relationship of remedies is very important. And it is also like this, sometimes we see a patient in a transition of remedies. For instance, we can see a patient going from phosphorus to graphitis. This graphitis type coming from phosphorus will usually be a lean graphitis, not an obese graphitis, not the typical graphitis picture we have. When graphitis comes from calcareous carbonica, then we have an obese graphitis, the typical graphitis as described in the books. But there are also lean, very skinny graphitis patients. So all those things are important, but I'm not going to give too long introduction. I'm going to start to talk about the miasmas now in chronic diseases. Well, first of all, we start, of course, with the psora. And the psora is, in fact, the most difficult miasma to treat. The psora is the miasma that gives headaches in homeopaths and hypertension in homeopaths. So what is typical for psora? When we look at the pace of the miasma and at the dynamics, we see that typical for psora is the alternations of diseases. For instance, a skin problem is cured or healed, and then we go into asthma, an asthma state. And then the asthma is treated, and the asthma is replaced by a colitis, by an inflammation of the colon. And then the colitis is treated, and we go into a rheumatic system, into a rheumatic complaint. You see the alternations. They go from one organ to the other. That is psora, but in a slow pace. Psora does not do this quickly. On the other hand, tubercular miasma, there it goes quickly. In psora, it goes quite slowly. So slow pace and alternation, so changeable miasma, a very changeable miasma. Very often, a psoric patient has problems with thermoregulation. In psoric patients, very often, or he or she is too cold or too warm. So their thermostat is not functioning very well. Very often we see the carbonic constitutions coming up in psora. And when we can do prophylaxis and we can do prevention in homeopathy, we can help the patient and say, be careful with this. If you have a typical psoric patient, you should tell him, try not to get too obese and too plethoric, because at your older age, you will develop hypertension. You can be sure of that. This is one typical example of how we can maybe help a patient by healthy life or whatever, or by some homeopathic remedies to prevent this end stage where he gets too fat, get too obese, and he develops hypertension. It's very typical for psora. Eczema, for instance, when treated, can go, like I said, into many other localizations of disease. The typical alternating psora miasma. Which are the most important remedies we can use in psora? We have a few of them. I'm not going to give them all. So Nux vomica, sulfur, Calcarea carbonica, Lycopodium, the remedy of the person who gets old quite quickly, problems with liver, quite intelligent but weak constitution. Physically, Lycopodium is not so strong. Kalium carbonicum, also an important psoric remedy, where we see the cardiopulmonary diseases coming up with a kind of edemas. And the first edema we see, of course, in kalium carbonicum is the edema of the upper eyelid. But we also see in kalium carbonicum the edema of the feet and so on, of the ankles. Antimonium crudum, Graphitis, sepia are there. Psorinum. And so this is in fact the very short description of psora. The next important miasma we should study is the tubercular miasma. Here also in tubercular miasma, we also have alternations, but there is a difference between the alternations of tubercular miasma and psoric miasma. We knew in psora, the alternations were quite slow and went from one organ to the other. It was a big jump in psora from skin, for instance, to joints, or from skin to colitis, whatever. Well, in tubercular miasma, the alternations go much quickly, first of all, and mostly they stay in the same system in the same anatomic system. For instance, change from sinusitis to bronchitis, from bronchitis to pneumonia, but it all remains mostly in the respiratory system. The same from cystitis to nephritis. So in tubercular, alternation tubercular miasma, mostly the alternation remains in the same anatomic pathological system. So in tubercular miasma, we very often see in the antecedents, we see very often respiratory problems, infection of the throat or the bronchi, sinusitis, whatever. Tubercular miasma, mostly fragile people, very fragile people. Emotionally, strong, very strong emotions in tubercular miasma. Very often artistic people. In fact, we are blessed with tuberculosis because tuberculosis was the disease that raised the artistic writers, painters, whatever. Artists are found mostly belonging to tubercular miasma because it is their nature to investigate, to go on adventure, to try things. The only thing that the tubercular miasma hates is routinism. You know, the desire for change, as is written in the repertory, is very typical for tubercular miasma, very typical. And we know that in the beginning of the 20th century, the tuberculosis was in fact an epidemic in Europe, not only in Europe. So tubercular miasma people, emotionally, very strong emotions. A tubercular patient very often comes to you and sits in front of you in the consultation room, and you ask him, what's the matter in fact? And he has very often difficulties in expressing his complaints. He very often says, I don't feel well, I don't feel so good. Immediately, reflect must be, think of tubercular miasma. I don't feel good, but I cannot say exactly where it is or where it starts. Very typical for tuberculosis. Palpitations, extrasystoles, but you don't find anything cardiologically, tubercular miasma. People with neurocirculatoire asthenia, they are very tired often, they are easily tired. At the evening, they have to go to sleep early, and then they wake up in a bad mood, and we all know it from tubercular miasma. The association of heart, lung diseases, also tubercular miasma. Very often acute rheumatoid arthritis. Well, I can say the few people I could help with rheumatoid arthritis all needed once or in a while, they needed tuberculinum. It is very seldom that you can cure a person with rheumatoid arthritis, or you can help a person without an ozode of tuberculinum, without the different tuberculinums. It is very seldom. The same with Crohn's disease, with colitis. Very often they need tuberculinum as an ozode, as an intercurrent remedy. And it is like that because every disease that has periodicity, we must immediately think of the tubercular miasma. Very typical for tubercular miasma. Migraine, for instance, very often needs tuberculinum, very often. People who had rheumatism in the past, in the youth, and afterwards they had problem with the mitralis valve, very often tubercular miasma, very often. Well, where we see at the end of the psoric miasma, when they get older, they mostly, when they get fat and develop hypertension, in tubercular people, we rather see hypotension, not hypertension. And also very important in the tubercular miasma is the troubles with the veins. The veins are very often affected, kind of insufficient perforant veins, or venectasias, or varices, whatever, or phlebitis, very often tubercular miasma. But if the veins become so insufficient that you have the development of varicose ulcera, then you are in the syphilitic miasma, not anymore in the tubercular miasma. So the ulcera, where we can use many remedies like azafoetida, for instance. I remember a few cases, azafoetida a few times closed varicose ulcer, but this is mostly in the syphilitic miasma. So anything that has to do with respiratory pathology, circulation, and so on. And what is also typical for the tuberculous miasma is the decalcification of the organism. So mostly the people are quite chilly, not all of them are quite chilly, and very often we see signs of decalcification. So which are the most important remedies in the tubercular miasma? We have pulsatilla, and I'm going to tell you something very interesting, practical. If you see a chamomilla child, you would give chamomilla immediately, but you find out that the predominant miasma in the child is tubercular, give pulsatilla. Don't give chamomilla, chamomilla will not work. Only pulsatilla, because pulsatilla is a typical tubercular remedy, belongs so strong to the tubercular miasma. And you can say, yes, but the chamomilla reacts in a different way than pulsatilla reacts. Okay, it is written by Ken too, a chamomilla child. You're angry with the child because she reacts that way. In a pulsatilla child, you feel compassion. Well, in case you find out the tubercular miasma and the tubercular stigmata, you will need pulsatilla. And pulsatilla can be as capricious and as mischievous as chamomilla. Don't worry about this. Which are the tubercular? Very often the tubercular miasma, we all know the grinding of the teeth during the sleep, the interscapular hair we see in tubercular miasma, the different respiratory infections they have, so very often big tonsils and so on. So the tubercular remedy is pulsatilla, sulfur iodatum. What is the sulfur iodatum? Well, be very careful when you have, for instance, an acute otitis in a child, and you should say, yes, this is very typical sulfur child. Also acute, you will give sulfur. Be very careful, because sulfur in an acute otitis can give very serious aggravations, because the otitis is localized into a bony hole with very few escape channels. Here, the sulfur iodatum is the more safe remedy. You will need sulfur, give sulfur iodatum in such a case where you expect aggravations. And this is not only for sulfur, it's also for phosphorus. If the iodatum, adding the iodatum salt to the remedy makes the remedy more friendly, more or less aggressive. This is very typical, sulfur iodatum. Another very typical tubercular remedy, natrium muriaticum, Bryonia silicea, Crategus, also tubercular, Calcarea phosphorica, typical Calcarea phosphorica, Drosera, phosphorus. And then we have the different tuberculinums. You have tuberculinum bovinum. It is well described by Kent, well written by Kent, but I usually also use tuberculinum Koch, or tuberculinum residuum, or tuberculinum marmorek, or tuberculinum denis. I'm going to give you a very short, because otherwise it takes too many time. Tuberculinum Koch is the most quick-acting tuberculinum. And tuberculinum residuum, when you need some tuberculinums in joint problems, in skin problems, think of tuberculinum residuum. It is the more psoric tuberculinum, the more slow tuberculinum, while tuberculinum Koch is more the syphilitic, more syphilitic tuberculinum. Then you have a third type of tuberculinus, marmorek. Well, I use marmorek very often in children that have very low immunity, or very delicate build, or very weak in their reactions, have not a strong reaction to viral infections, are regularly sick, and they give a syphilitic expression, an oxygenoid expression. They look quite pale, they are emaciated, and so on. And then also the tuberculum aviare. The tuberculum aviare you can use, for instance, in asthma, on condition that the asthma is moist, not in dry asthma, not in dry spasmodic asthma. Don't do it. Use it mostly, when you use it in asthma, use it in asthma where you hear the respiration rattling, where you have the tendency to give antimonium tartaricum or Barita muriatica, whatever. Don't forget tuberculinum aviare here. And another very strong, interesting indication for tuberculinum aviare is the recurrent otitis in the child. Recurrent otitis in a child, especially when, for instance, the child, very often you hear, they went to swim, the children went to swim, afterwards there was an otitis. We can think of remedies like Bellis perennis, like Antimonium crudum, whatever, but do not forget Tuberculinum aviare here together with Psorinum. For instance, in those cases, I give Tuberculinum aviare in a 15 CH once a month and Psorinum in a 9 CH once a week. And you can continue this for quite a few times, and you will see the immunity against, specifically against otitis media, will become much better. So the third miasma we have to discuss is psychosis. And psychosis, what can we say about psychosis? So about psora, we can say it is slow and changeable. Okay, about tubercular miasma, we can say it is quick and changeable. Well, in psychosis, it is slow but permanent, not changeable. It is a typical chronicity situation. Psychosis is chronic. If we look at hypertension in psychotic patients, first of all, typical for psychosis is the fact that most symptoms remain hidden for a long time. That's typical for psychosis, the secretivity of psychosis. So if we look at the hypertension in a psychotic patient, he will have hypertension from the moment he is 24 years old, for instance, but he will not produce symptoms of it. It is a silent killer here in psychosis until at the age of 55, suddenly he contracts a stroke or a myocardial infarction. This is the typical psychotic way. So the chronicity. Psychosis is slow in pace and permanent. It is irreversible. This is very typical for psychosis. So, like I said, you can, I forgot to say, you can, for instance, have a psoric asthmatic patient with tubercular aspects, with tubercular stigmata, but that asthmatic patient, that psoric asthmatic patient, becomes psychotic because of the cortisone treatment he has. So, psychosis can be acquired by many remedies, like vaccinations. Vaccinations can produce psychosis, corticoids, hormones, anticonceptive pills. They can all develop psychosis. Also, exotic diseases, as we call in Europe, exotic diseases can develop psychosis. Corticoids, like I said, and the anticonceptive pill also. So we have to look at psychosis in different stages, otherwise we make mistakes. So the first beneficial state of psychosis is the catarrh, the discharge. As long as that happens, it's okay. That's the first stage. The second stage of psychosis is the stage of infiltration. When the discharge stops, the person totally changes in physiognomy. He becomes obese. He got hypertension. He got infiltrations everywhere, cellulitis. He develops very large hips. All the symptoms of psychosis. He develops warts, condylomatas, whatever. This is the second state of psychosis. And then we have a third state of psychosis, and this is the stage of sclerosis, of stiffness, of retraction. Like we see, for instance, in some diseases, like Dupuytren diseases, like La Peyronie diseases. This is the third stage of psychosis. And you can believe me, some people get born from their birth, can be in the third stage of psychosis. My son was like that. He had kidney stones when he was one year old. So it means that he was, in fact, born in the third stage of psychosis. Kidney stones, everything that is getting hard, sclerosis, stone formation, third stage of psychosis. I'm going to immediately tell you about the importance of that differentiation in stages of psychosis. So, like I said, in psychosis, in the second stage, we have cysts, we have calazion, we have polyps in the nose, and so on. And then in the third stage, we have the retraction and the fibrosis and the psychosis. So psychosis, like I said, is slow, but stubborn, chronic. It goes from A till Z. It does not change anymore. It continues to be a very chronic and very often hidden disease. The same when we have psychotic pneumonia, where we need very often natrium sulfuricum. The problem is, in such a pneumonia, we cannot find the diagnosis so easily. The patient has fever, for instance. We do the auscultation of the lungs, and we say, yes, but I don't hear crepitations. I cannot make the clinical diagnosis of pneumonia here. And then we do a CT scan or an X-ray, and then we are surprised that we see an infiltration in the lungs. This is the typical psychotic pneumonia. Psychotic means hidden symptoms, not easy to find. And because of the slow pace of psychosis, you must also realize that you have to have patience. You have to have patience with treating a person with a psychotic remedy, because of the slow pace of the miasma, it can take quite a time before the patient reacts. So in a psychotic prescription, do not change your remedies too often, because then you're somewhere in the mist or in the fog, wherever you get lost. So very interesting to know the typical psychotic remedies. We see 2-year natrium sulfuricum, hydrastis, and it's maybe interesting to say that lately I had 2 or 3 cases where a woman with malignant Papa Nicolau tests of the cervix of the uterus, where bad cells, malignant cells already were found in situ of the cervix. 2 or 3 of them, I could give blindly hydrastis, and after 3 months, I went to the gynecologist again, and one of the professors almost fell from his stool, from his chair. He said, I don't see anything anymore in your cervix. All the bad cells are gone. The suspect cells are gone. It's quite normal. How can it happen? And then the woman answered the professor, yes, but I was treated by a homeopath. And then the professor immediately said, I don't believe in homeopathy. So he can believe in what he wants. It's his problem, not mine. For me, it was okay that the woman was held preventively. So we can don't let anyone tell you that you cannot do prevention with homeopathy. Some people say you cannot do prevention because you need symptoms. No, you must find something before the symptoms, because I'm going to tell you another thing. Very often, we all know the totality. The totality is the sum of subjective and objective symptoms. But very often, before we find the totality is very often preceded by a physiopathological similitude, which can be clinical mute at that time, but the physiopathological similitude can be used before and successfully prescribed on before we prescribe on totality. It is very important to realize this. You don't always have to wait for totality. Very often you see the indications for a correct remedy much earlier in the so-called physiopathological similitude, notwithstanding the fact that there are a few symptoms, you already can find it. So we have the other typical psychotic remedies, conium, aranea diadema, dulcamara, staphysagra, medorinum, and so on. How can we, sometimes we can recognize a psychotic person. How does he look like? Mostly he has a very round face, not the typical chin of tubercular miasma. Tubercular miasma, we see the chin, the face in a triangle, in fact. In psychotic persons, we see a moon face, a round face, and very often very small hands and very small feet. Also be typical but it depends also on the stage of psychosis. But very often in congenital psychosis, we see the round face and the small hands and small feet. Very often we see also in psychosis the total rhomboid formation of the body. So the shoulders are not so broad, so large, but especially the pelvis is. It go like that, and then again so rhomboid. That's very typical. The rhomboid, the infiltration the adipositogenital constitution, the large hips, very typical for psychosis, very typical. The warts and so on. And indeed, psychosis, very often we find hypertension, but it is a hypertension without symptoms. You don't see hypertension with headaches in psychosis. No, it will go gradually, hidden, and then suddenly he has a myocardial infarction. That is psychosis. He never, yes, I had hypertension when I was a student, but I didn't feel anything, so I didn't take any remedy for it, and then it contracts a myocardial infarction. And then it depends. It depends. Every stage of an acute myocardial infarction is an acute syphilitic state. Syphilitic miasma is the miasma with the highest chance of acute lethality. It is the closest to death. This is the syphilitic miasma. So it depends on if he survives in myocardial infarction or not. In a psychotic patient, usually he survives, and then they give him 2 or 3 stents, and he can live for another 20, 30 years. That's psychosis. In a syphilitic patient, we have problems. Or he dies suddenly, or he has a strong reduction of his ejection volume of the heart. And that's, I want to tell something practical about this too, because otherwise I forget. We all know that homeopathy, like I said, is in fact an individual. We must respect the idiosyncrasy and the individuality of a patient. I agree 100%, but I can guarantee you that we all should give, after every patient with a myocardial infarction, we should, from, let's say, 2 weeks after the infarction till 3 months later or 6 months later, we have to give every myocardial infarction patient calcarea fluorica. And with calcarea fluorica, we can help him in many ways. So you can say this is a general prescription, this is not an individual, it is indeed, but it is a miasmatic prescription. I'm going to explain you. What is calcarea fluorica doing? Calcarea fluorica, and we know it from Farrington, and we know it from the big French homeopath, Latoux. Calcarea fluorica makes scars more flexible, less rigid. So, and what do you have to do? We know that there is a local necrosis in the myocard muscle after infarction. After giving calcarea fluorica, you can prevent that this local necrosis becomes very rigid and very stiff and not mobile anymore. And this process will reduce the ejection volume, which is normal, 55 after myocardial infarction. Very often you see, especially in syphilitic patients, because calcarea fluorica is a syphilitic remedy, but in syphilitic patients, you will see that the ejection volume post-infarct is reduced to 40, for instance. We have the duty, and that's what Hahnemann says. If we don't do homeopathy properly, we are criminals. If we forget to treat a patient homeopathically in the right way, we are criminals, Hahnemann said. We do a crime. We are guilty of a crime, he said. So this is caricature, of course, but we should give. When we give calcarea fluorica, what can we do? We can prevent that the cicatrix after the necrosis of the myocardial muscle becomes rigid, and calcarea fluorica will prevent this rigidity and will take care of the fact that the cicatrix become very flexible and mobile. So then, and very often we can prevent the deterioration of the ejection volume. And after calcarea fluorica, very often the patient remains is 55 ejection volume. Very important, very important. So from now on, give it to every patient. And I was surprised when I studied some books of eclectics. A very good eclectic was Dr. Jones. Dr. Jones wrote about myocardial infarct. Every myocardial infarct, they give calcarea fluorica. I was wondering, why is this? But now I understand why it is. Calcarea fluorica prevents a lot of damage after infarction. And not only the cicatrix remains more flexible, but a lot of patients post-infarct, 5 years later, they develop La Peyronie disease. Also, this can be prevented by giving, after infarction, calcarea fluorica. This is also an important thing. The prevention of La Peyronie after infarction, which often happens. And a third reason is that I saw quite a few patients after myocardial infarct, they developed a frozen shoulder, a periarthritis, and a frozen shoulder. Also, this can be prevented by calcarea fluorica. So we have enough arguments to say that after every infarction patient, help him and prescribe calcarea fluorica. In a low potency daily, like in a 6C or a 3C, whatever, give it daily. Because you treat him here in an organotropical way, but in a very useful way, and to take care of his further life, that he will still be in good condition. That's what you have to do. And this is, in fact, what I said about the inductive method of homeopathy. This is induction. We start from facts and we go to laws, not the opposite. Not like some cases, some homeopaths do. They invent some hypothesis and then they try to go to facts. No, we start from facts, and from facts we go to laws, not the other way. This is in fact a very natural way, and this is also why some experienced homeopaths can say, yes, when we have an avascular necrosis of the hip, we see very often good results with aurum high and fluoric acid low. This is very classical Hahnemannian homeopathy, whatever, notwithstanding the fact that they use 2 or 3 remedies. It has nothing to do. Hahnemann used more than 1 remedy. Hahnemann almost, especially in Paris, started every case with sulfur. Why? Because he wanted to prevent a psoric block. He wanted to prevent that the psoric miasma would interfere with this so-called prescribed remedy. So, very important this. And then we come to the next very interesting miasma, which is the syphilitic miasma. Again, I have to say, do not mix miasma with disease. There are a lot of so-called syphilitic persons where you will never find syphilis in the anamnesis. Also in the other generations, you will not find it. Still, it is there. Still, it can be there. The same with tuberculosis. So, what do we see in syphilitic miasmas? We see very often syphilitic stigmata. I will talk about this later. But when, for instance, we see a very severe arthrosis of the knee in a young person of 30 years old, you can be sure here the syphilitic miasma is predominant. This is a very typical example. Very often we see that the nervous system is also, we see a multiple sclerosis, strong evolutive in a person of 35 years old. Things like that. What do we see? Let's talk about calcarea fluorica. Calcarea fluorica, a very typical syphilitic remedy. What do we see in calcarea fluorica children very often? Hyperlaxity of the joints. The joints become very, very hyperlax. This is one, there are other stigmas too, but this is one of the important stigmas. A syphilitic miasmatic person can be a tall person or can be dwarfish from size. Very tall or very, very little. A syphilitic person can be a genius or an idiot. So we see in syphilitic miasmas very often extremes, very strong extremes. Like we say, can be perversity, asocialism, not asocial in fact. A lot of deformations we can see. For instance, a person with 3 nipples is a syphilitic person. A person with syndactylia is a syphilitic person. I mean syphilitic miasmatic person. Very often we see in a person of 46 years old, we see an aneurysma of the aorta, very syphilitic, or an aneurysma of the circulus villosi on the base of the brains, where there is a rupture or an aneurysma, whatever, very typical aneurysmas, everything that has to do with aorta, myocardial infarction at a young age, very syphilitic. With the syphilitic miasma, we see the aggravation on the C side, not the amelioration like we see in psychosis very often. So malformations we see in the syphilitic miasma, atheromatosis, atherosclerosis at a very young age, aneurysmas, like I told you already, venous ulcera, also arterial ulcera, and venous ulcera of the lower limbs. Which are the most important syphilitic remedies? We have a lot of them. We have, of course, aurum metallicum, mercurius, nitricum acidum, argentum nitricum, kalium bichromicum, calcarea fluorica, phytolacca, fluoric acid, luazinum, and so on. About phytolacca, I can also say that, for instance, women premenopausal, they get some psychoneurotic neurotic problems. They become very nervous, they become neurasthenia, they get neurasthenia, become depressive. And then they start to eat and to eat and to eat as a compensation, they become very fat. And very often a marital problem is the causation of this, because they can be nervous because the husband does not pay enough attention to them anymore for one or another reason, whatever. And then they start to eat, they need compensation, they become very fat. And then at last, the result is that the husband even finds his wife more or less attractive. And the only thing that happens is things get worse and worse. And when you see such a case, it can be very often, initially, when you see it soon enough, you can help these women with two remedies, with phytolacca and with syphilinum, with luazinum. This is a typical phytolacca state. This is typical, and it is not well known and not written about it much in the Materia America, but this is a typical phytolacca state, very important to realize. So the woman premenopausal who is frustrated in a relationship with the husband, and she starts to eat as a compensation, becomes very fat, and then she got depressive, she becomes immobile, sedentary, or whatever. Think of phytolacca, homeopathic remedy, syphilitic remedy with syphilinum very often. So, so to make a summary, so in syphilis, the pace of syphilis is quite quickly, but permanent. Also, the syphilitic miasma is the miasma, like I said, closest to the death, in fact. And we all know from history that the syphilis maligna, the disease itself, which were the patients, there were patients that died from acute syphilis in a few days. And which were those patients? Those patients were the patients who were not able to transform their acute syphilitic miasma into psychosis. Because those patients that died early from the so-called syphilis maligna, they were not able for the formation of bubbles in the inguinal glands, of swelling in the inguinal region, of swelling of the glands, which is very typical in a syphilis. When the patient contracts syphilis and is not able to develop in his groins the swollen lymphatic glands, he will die after a few days. And you see, he remains in his syphilitic miasma. He is not able to go back into psychosis. So the transformation of miasmas also is very, very, very important. So what else can we say about maybe the tuberculosis? Maybe I like to talk about the tubercular miasma because we see it very often. And maybe I forget some things. So what do we see in the tubercular miasma? We see, for instance, the extreme variability of symptoms, like I said. From the symptoms alternate very quickly. The tendency to viral infections, demineralization, and very often the heart and the circulation are affected in the tubercular miasma. What is also very important is in the tubercular miasma, you know probably all this, the Gilbert disease, this disease of Gilbert, which is in fact a congenital deficiency of glucuronil transferase, so that the patient cannot in fact transform his indirect bilirubin into direct bilirubin. And when this is in fact not a disease. Syndrome of Gilbert is not disease, very, very often asymptomatic, unless we sometimes see some subicterus on the conjunctiva. So what is typical for the Gilbert disease is that we have a too high bilirubin, but without seeing an icteric patient or a sick patient. Very typical. This also, I don't know it for long, but I know it now. For a few months, I know it. This is typical for the tubercular miasma. The congenital problems with the liver, very often tubercular. So tubercular antecedents in the history of the family, of course. Problems with the respiratory system, allergies, very often psora. An allergy can be psora, an allergy can be tuberculinic too. And psora and tubercular very often go together. So like I said, not often you will see one clear miasma, very often you see mixed miasma. Like I said, little congenital problems with the liver, children who very often have acetonemia, acetonemic vomiting, very often tubercular miasma too, with a very reduced digestive capacity, the intolerance of fat food, very typical tubercular. There immediately you see the relationship between tuberculinum and pulsatilla. We know all that pulsatilla cannot stand fatty food. So this also is a tubercular sign. So the people who are always tired, tubercular miasma, very tired. I'm always tired. I never feel fit and so on. Very often, I cannot say really what's the problem with me, but I don't feel good. They don't feel good. So this is very, very typical in tubercular miasma. And as I said, very often we have hypotension, not hypertension. Hypertension we see at the end of psora and in psychosis and in syphilis, of course, the malignant hypertension. What kind of hypertension do we see in the syphilitic miasma? In the syphilitic miasma, we typically see the baryta muriatica hypertension, meaning a high systolic and a very low diastolic. For instance, 17/4 or 5. This is syphilitic. This is very often baryta muriatica. I do not claim that you will reduce after so many years the tension with baryta muriatica alone, but together with these allopathic remedies you must give baryta muriatica. The syphilitic hypertension, the big differential hypertension between systolic and diastolic. Allergy infections, of course, in French they say l'allergie fait liée à l'infection. It means when you're allergic, you're more susceptible to infections, typical tubercular miasma. Demineralization. Demineralization, you very often see it on the teeth, the demineralization of the teeth, like we see in Basilinum, for instance. They lose their tartar very often in Basilinum. We have the color, the discoloration, yellow discoloration of the teeth and so on. The tubercular miasma very often manifests itself into periods where there is a change in the life of the patient. For instance, adolescence. In adolescence, very often you see the tubercular miasma coming up. You see this also in tubercular miasma coming up in the menopause of women. Don't forget tuberculinum for menopausal complaints in women. Not only the flushes of heat, whatever they have. And we see the typical tubercular patient as a lung patient, lean, emaciated, very often with deep orbita and so on. And then we have the demineralization with all the problems of growth and so on. And we see people who grow too rapidly. We see phosphorus there, calcium sulfuric, typical tubercular remedies. We see guaiacum there too. Problems with caries, very often tubercular, very often. Bone pains, the nightly growing pains of children, very often tubercular. And then you should never forget, and this is very important, that everything that has to do with cryptotetany, with spasmophilia, it belongs to the tubercular miasma. So this is about tuberculism. And like I said, the disease tuberculosis was conquered more or less by tuberculostatica, but the tubercular miasma, forget it. Only we as homeopaths can do something about it.
Dr. Eddie, can I bother you for a moment? In case you've forgotten, we would like you to speak about the miasmatic spectrum of diabetes also.
Okay. So in diabetes, very often, I must admit that we need allopathy in diabetes. I think we all agree. And I'm going to show you some cases where I could help diabetes patients with homeopathy. And we will show these cases later. Very often we see, of course, in diabetes, when we have the typical insulin-dependent diabetes, we have to do with very often syphilitic miasma or a sickle syphilitic miasma, because every autoimmune disease that attacks its own tissues, in fact, belongs to a syphilitic miasma, very often. So maybe we can, I can show you now, because you want to talk about diabetes, I can show you a few cases. Both patients are treated with insulin, but homeopathy still could help them. And maybe Dr. Anna can help me with showing the first case of diabetic gangrene of a patient. We'll show you some photos on how we did it. If it's possible. So this is a case of a man, for me, the man is psychosyphilitic. If we have to judge him miasmatically, psychosyphilitic, whatever. So I know him quite a long time, and I could cure, many years before, I could cure his varicose ulcera with, if I'm not mistaken, it was with azathioprine or another remedy, I cannot remember exactly. But now he comes back and he has diabetes and he has diabetic gangrene. So we know that gangrene, immediately we have to think of a syphilitic miasma. It has to do with necrosis, with destruction. Syphilis is the destructive miasma. So he is 80 years old, he's quite obese. He's quite dyspneic, he's a shoemaker, he makes shoes, and we see him here. Well, in this case, I did not have many characteristic homeopathic symptoms. So I thought by myself, I have to look at the case instead of looking at the rigid totality. I have to think about physiopathology. So what I have to do, we all know that this is a case of microangiopathia. And if I'm not mistaken, I prescribed him botrops. And I prescribed him botrops. Maybe we can go to the next slide. I prescribed them botrops 3 times a day in a 6C. Why botrops? Because we know botrops is such an interesting remedy that has to do with so many circulatory problems, also with coagulation of the blood, in microangiopathy. And in Boerike, gangrene is written about botrops. Botrops is written in gangrene in Boerike, so I prescribed it. And then today, the condition is a little bit better, less infection, less painful, and more dry are the thing. And then we go to the other, the third one. So you see, this is the result now after taking botrops. A very good result, and we see the very tiny necrosis focus on his third toe. I'm not mistaken, yeah, on his third toe. And from then on, I told by myself, I read in the Materia Medica, somewhere, not in Boerike, that maybe I can get it even a little bit more better. And I added Solanum nigrum, because Solanum nigrum is a remedy we have to think of immediately in diabetic food. You can say this is pathological prescription. Yes, it is. And pathological prescription is very important, because what do you expect at such an end stage of pathology? You expect many things about constitutional remedies. I do not. so-called constitutional remedies that the patient needed 20 years or 30 years before will not help them anymore. And if they are prescribed correctly, you will see nothing but aggravation. So be very careful with prescribing a correct constitutional remedy when it is not the timing to prescribe it. Very important. So then I gave him, so to make things better, I continue with Botrops and I added Solanum nigrum. And then we can see so it was a pure materia medica prescription indeed. Like I said, diabetic microangiopathy, I told it already. It takes Botrops, Solanum nigrum, and Solidago. Solidago also as a very important remedy to help him to get rid of toxins, especially via liver and kidney. Solidago, a very, very important remedy, which you can add. Why? Because if you prescribe quite the correct remedy, and like I said, the organism is not able to get rid of its toxins, you have problems. And what are problems? Aggravations. And what are aggravations? Aggravations are the proof that the patient is not able to get rid of his toxins. Nothing more, nothing less. In my opinion, nothing to do with any potency, whatever. I've seen many serious aggravations in the low potency, and I have seen many aggravations in high potency. And also Kent writes about this. Kent says, let us thank God that not every prescription is correct, because otherwise we would drown into aggravations. That's what Kent says. So it's good to prescribe the constitutional remedy when it's indicated at that time, not at another time. So here we have indeed diabetic problems, and that's why I also prescribe Solidago. He has the Kimmel-Steele-Wilson disease as a complication of diabetes. So this morning I also see even the situation is even better now after Solanum nigrum. The focus, the necrotic gangrene focus has even become more and more and more less, you see. So Botrops first, a physiopathological prescription, and then Solanum nigrum afterwards. And I support his kidneys with Solidago low too. Okay. That's one of the one of the cases. So about diabetes, so the patient, of course, when the patient needs insulin, how are you going to do this with homeopathy? When he needs insulin, he needs insulin. When he needs oral antidiabetica, he will need it allopathically. But still, you can help him a lot. I remember once I had a woman with diabetic polyneuropathy, and you know, it can be very painful. It can be very painful, the polyneuropathy, or they don't feel anything anymore, anesthesia, or they have hyperesthesia, very painful feet. Well, she was helped wonderfully with Helonias. Helonias, do not forget, in diabetic polyneuropathy. Just a tip. So then we can go to another complication of a young girl, a young child, and she got diabetes, insulin dependent. And then she comes with a dry cough, a spongia-like cough, so a kind of tracheitis cough. So here again, we can help, notwithstanding, it is not allopathy or homeopathy. They can go together, and they can go wonderfully together, believe me, wonderfully. What do we see here? She coughs. What do I see when I look at the child? Like I said, observation of facts is important in homeopathy. I see some malar flushes of the cheeks, but perioral, there is a paleness around the mouth. So immediately this must make you think of certain remedies. And when you combine this, the spasmodic cough with the diabetes and with the perioral paleness, you have carbolic acid. You have carbolic acid. So the cough was gone in 24 hours. Just to show you that in fact, we can also help patients with very, very severe diseases allopathically treated. We can help very well in homeopathy. So the observation, you see the paleness around the mouth, very important for that remedy, carbolic acid, very important. Maybe we can show a few other cases now to see how important miasmatic diagnosis can be. And we can start with the coxarthrosis first, I think. Yes. So this is a very interesting case. is a woman, 75 years old. She has Cox arthrosis. And she went to the orthopedic surgeon and he proposed a total hip replacement. Of course, why not? So she has bilateral pains, especially left. When she turns in bed, she has problems, of course, painful. The pain extends from the hip to the knee, which we are used to that symptom in clinics. Cramps in left thigh turning in bed, uncovering at night aggravates, lameness in hip and thigh. Well, I know this woman, like I said before, already helped her with diverticulitis of the sigma with Spigelia. And now she has, at this moment, I gave her a few remedies. I already forgot which one, Rustox or something, or something else, no effect. Then she comes back for the second time and she tells me from the moment at night that I uncover my knee, I immediately have serious pain in the hip. So, and I'm going to give you a good advice. When you see some clear modalities, in my opinion, one of the most important repertories you can go to is Börige. When you go to Börige and you see modalities uncovering aggravates, you see the different remedies there. And then she tells me, then I see a remedy that catches my eye immediately. And then I asked about diseases in the family, and she says that her brother, as a neonatus, had tuberculosis and Down syndrome. Tuberculosis also. Yeah, like, okay, so I gave before I gave Pulsatilla and Colosintis, it had no effect. But now I see, for instance, I see the fact the brother has tuberculosis, the woman has a kind of tickling cough with tickling in the fossa suprasternalis here. And then I look at the, can we also look at the repertory? I don't know if that's possible, it's not so important. Of the repertory of Börige. It's not important, but Drosera was there. Drosera was there and we all know the Drosera, the typical tubercular miasmatic remedy, Drosera. And then we go and read in Börige and we see pains about hip joint, I think. Pains about hip joint. Paralytic pains in the coxofemoral joint and thighs, irritative cough from subasternal fossa. And she also tells me, every winter I have that same cough. When you hear this, this is tubercular miasma. Periodicity is tubercular miasma. So the remedy I prescribed was indeed Drosera. Drosera, can we go to the follow-up maybe? The next slide. No. Drosera, 5C, 3 times a day, a quick relief and total hip replacement until now is not necessary. She's doing well. I also tell her if it's really necessary and nothing helps anymore, you can do it. But as long as you're free of pain, you don't need the hip replacement. We will try to help you with homeopathy. So again here, the fact that I could spot the miasma in this case helped me to prescribe Drosera. And indeed, when you read Börige, somewhere, every sentence, every word, every comma is important in Börige. Everything is important. It is such an important repertory. When he says it helps in hepatology, it's good for Cox arthrosis, it helps with hip pain, you can believe it. And I remember a student of mine 10 years ago in Moscow, she mailed me that she had a quite severe pain in the hip joint. I don't remember exactly which one I'm going to see. And she already took so many remedies without effect. And I was worried, I was very worried about her because the pain was so strong that she could not do a regular work as a homeopathic physician. And then I remember somewhere to have written, to have read in Börige, violent, it was a left hip, violent pain in left hip. Only on that, I prescribed stramonium. And stramonium helped in 24 hours. So, in fact, if it's possible, we should know Börige as much as possible by heart. I know it's not possible, of course, but every word that is written in Börige has a golden value. You can believe it. So, violent pain in left hip, That's all he writes about it. And stramonium helped this woman very much, very quickly also. Yes, can we go to maybe the next case of celiac? Okay, so another case where miasmatic analysis becomes quite important. So it is a 10-year-old girl. She has freckles all over the face. And of course, there is an intolerance for gluten, also for lactose. She's constipated. She has large stool balls, kibale, abdominal complaints. And then the mother tells me that on the right ankle, she had a large aneurysmal cyst. So if you hear this, if you hear the word aneurysma, immediately think of the syphilitic miasma, immediately. It can also be tubercular, because tubercular is psora and syphilis together, whatever. So she has large tonsilli, recurrent anginas. 5 months ago, she had COVID, and she also has recurrent cystitis. Also in recurrent cystitis, do not forget tuberculinum. She has further ex ore, a very offensive breath. The cervical lymph nodes are swollen. She likes salt and ice cream very much. Yes, you could say immediately we think of phosphorus, okay, but be careful. Okay, phosphorus belongs to the tubercular miasmatic remedies, but be very careful doing this. Sun aggravates. And then the mother tells me 2 times she had scarlatina. And once she had a scarlatina maligna. It means because of the scarlatina, she developed an abscess on the right nipple. An abscess on the right nipple. If you see this, this is a complication of scarlatina. This is scarlatina maligna. And scarlatina maligna is again written very well by your famous master Phatak in India, famous Indian homeopath. So it had to be incised and pus came out. The mother had tuberculosis. Okay. So again, I looked how in the past, how did she get rid of toxins? Well, in a very difficult way, because she developed scarlatina maligna. Yes, we can go to the next slide, please. Now, so indeed, we concentrate on the way how the organism detox itself. So we have 2 rubrics in Phatak. 2 rubrics in Phatak I took. Breath offensive during constipation, carbolic acid, and scarlatina maligna in Phatak also, ailanthus, ammonium carbonicum, carbolic acid, and lachesis. So I totally disregarded the desire for salt here and the desire for ice cream. And I remember having read some cases of the big master, Dr. Burnett, when he does the same. He says, in fact, okay, the desire salt and the desire ice cream are very strong homeopathic constitutional rubrics. But the most important thing is, how does the organism try to get rid of its toxins? And that's why I combined those 2 remedies. When constipation goes together with an offensive breath and scarlatina maligna, and I came to carbolic acid. And then what did I do? I prescribed carbolic acid 4CH once a day. And I added tuberculin marmorec every 3 weeks in a 9C, because of, first of all, the heritage. The mother had tuberculosis. It was a very delicate child. It is certainly a syphilitic miasma, because everything, when you hear the word scarlatina, it is an expression. Scarlatina is a way that the organism uses to get rid of syphilitic toxins. The same with mumps. Mumps and scarlatina are pointing to the syphilitic miasma, while whooping cough points to the tubercular miasma. So if you hear mumps, if you hear scarlatina, it is syphilitic. So that's why I added tuberculin marmorec once in a month. Now 6 months later, the angina symptoms are gone. Constipation is gone. She does not smell, not a smelly breath anymore, and she feels much better. And you see, scarlatina is syphilitic, and marmorae is a kind of tuberculinum type you can use in oxygenoid tuberculinum. Oxygenoid, of course, is the same as syphilitic, a syphilitic tuberculinum. And the girl also, the very delicate aspect, she is sick very frequently. And then when she reacts in such a way on scarlatina, you can be sure this is double syphilitic. Scarlatina on itself is already syphilitic, but scarlatina maligna is double syphilitic. And that is why the carbolic acid helped the girl also very well. You will see afterwards, also even with the chronic disease of celiac. Yes? Okay, next one. So she's doing very well. The celiac problems are much less. The mother still is following a kind of diet. The stool is okay now. She's very careful with gluten and so on, but it seems that she tolerates it much better. And now I go on with 1 dose of carbolic acid, 7C once a week, and then tuberculinum marmorae every 3 weeks. The tonsils are quiet, still large, but quiet, and there is no cystitis anymore. So there is a good evolution. But you see that, in fact, it is a matter of daring to disregard symptoms sometimes, because a lot of patients, colleagues would say, why don't you use that desire ice cream? Yes, but tuberculinum is also in desire ice cream. And why don't you use desire salt? Tuberculinum is also in desire salt. It is not always phosphorus. Be careful jumping into what I say again, try to look, try to find a pattern how an organism is trying to get rid of the toxins, because that is what is trying to get rid of a fever, for instance. A fever is an acute attempt of the organism to get rid of toxins. That's a fever. A hay fever. A hay fever is a periodic, is in a periodic way that the organism tries to get rid of toxins. Every spring, for instance. Hay fever. So this is tuberculosis, psoriasis, and so on. So here we had Brett in, you know, Fatak. Fatak is a repertory that makes miracles. I use it so often, and I'm so happy with that, because of course we all know the repertory of Kent is very good. Kent is a very, but we see. I use them both. I use Kent, I use Burger, I use Fatak. But I like to use Fatak very much, because especially in the 4th edition, I think the 4th edition, which my good friend Dr. Amil Abou gave me, we see additions of Fatak which are very, very, very useful. Very useful. I can only recommend this repertory to everybody. Okay. So what was I talking about? Okay, so we can go to the next pain in the hip. Yeah, we can look at pain in the hip. We see the rosera there, pain in the hip. You see the rosera. How can we think of the rosera? How can we find rosera when we do not put enough attention to the miasmatic analysis of the case? We will not find it. We cannot find it. And also another thing I almost forgot to say: if you use the repertory of Kent, please do it like he recommended it. Go from generals to particulars, and do not start with particulars. Be very careful when you use the repertory of Kent is the best, but use it like it has to be used. When a patient tells you, I have stitching pain in my stomach, please go to the generals and put general pain stitching, and do not go to stomach pain stitching, because you will miss remedies. This is how Kent wants us to do it, and it's really, it works that way. Yeah, the aggravation of uncovering. And again, I said, for certain symptoms, I use certain repertories. For instance, when you have a typical patient, in front of you, and that patient is very delicate, please go to the clinical repertory of Clark and look in the chapter temperaments, and you will find a lot of information in Clark. And you go to temperaments, delicate constitution, for instance, delicate children, sickly children. Look how great, because it doesn't mean immediately that it is the remedy there, but it will help you a lot. And sickly children, so I know, especially when they are chilly. Sickly constitutions with pure white skin, eyelashes, delicate eyelashes. Xanthoxylum, for instance, delicate women, Xanthoxylum. It can help you in many gynecological problems. In Xanthoxylum, very often we have the delusion that they can fly. But don't give Xanthoxylum in a plethoric woman. It will not work. It will not work. So Xanthoxylum, dream, they can fly. Also Xanthoxylum. Okay, and we can go to the next patient, which is the mother of the celiac girl, I think. Yeah, this is the mother of the celiac patient. Also from miasmatic point of view, very interesting. The woman is born in 73 and she has dark complexion, dark eyes, dark hair. It's in the family, dark complexion. Of course, we see it. I can imagine that in where you live in India and so on, and in the Emirates, most people are dark complexion, but here we use it. We use it in Europe. So she had tuberculosis when she was 6 years old, and she had quite a long treatment with tuberculostatica. And then the woman tells me, the woman said, after all that treatment, my diseases started. That's what the mother of the woman says. And like I said, tuberculostatica, they conquered tuberculosis, but they did not conquer tubercular miasma at all. Recurrent tonsillitis, followed by tonsillectomia. Okay, they take it away. What they cannot cure, they take it away. Brittle teeth also point into the direction of tubercular miasma. Allergy, hay fever, asthma in the youth, as tubercular can be. Only a little bit hay fever remains for certain trees, birds especially. Asthma around 8 years old, and she has a wrinkled forehead. Everything you see, observational facts, everything you see is important. Often lifts up her brow when speaking. Strange enough. And she speaks softly in a quiet voice. She's so softly in talking that you almost has to say, what did you say, Miss? And she's very softly, quietly. She contracts varicella at the age of 17, which must make us think of carcinosinum eventually. And again, the woman, 2 times, she contracts scarlatina together with her daughter. So again, you see syphilis, tubercular syphilitic. So the least we can say, indeed, is it is a multimiasmatic case. As Hahnemann said, most cases are. Paragraph 40 in the organon. More than one miasma active in the same organism. And like Alan said, if we have more than one miasma active, we very often have a malignancy on our hands. Constipation, bowel discomfort, she takes macrobiotic food, and she has no energy, no stamina. Next slide, please. Her first child at the age of 35, and during the first delivery, symphysiolysis, PSH shoulder, right shoulder developed to frozen shoulder. This is again the frozen shoulder. This is again the 3rd psychotic stage, very often. Therapy, little effect. Her husband, from whom she divorced, is a military man, and they moved very often from one country to the other, Australia, Austria, and so on. Austria, she lives now. She has calcification of both rotator cuffs. Again, calcification is 3rd psychotic stage. She has extrauterine gravidity at the age of 27, which is a syphilitic symptom. You see, all kind of miasmatic influences are there. Pancreas cancer and other cancer in the family. Pancreas cancer is the syphilitic cancer par excellence. The syphilitic cancer par excellence. Why? It stays psychotic for a long time, and then suddenly it outbursts. That is typical. It stays psychotic for a long time, hidden. But at a certain moment, when we see symptoms, it's too late. The typical syphilitic cancers are pancreatic cancer, ovarian cancer, the same problem, and melanoma, very often, melanoma also. But more now lately, allopathy has done great investigations and has a great success in treating melanomas. As a child, she was timid, so we can also say psora, yeah, okay. Had sinusitis often in the past, psychosis. Some pap tests were suspicious, but latest was okay. Operated for wisdom teeth, I think. Mother had Helicobacter pylori, so strong that the mother has to be hospitalized for this. Neck problems, okay, yes. Next, yeah. So we make a repertorization here. And for the temperaments, the first rubric I took, dark complexion. Very dark eyes, dark hair. And for this, I always go to Clark. Sometimes also to Ken, but mostly to the repertory of Clark. Then speaks in a low, soft voice. This is a very interesting rubric in the mind of Kent. Speaks in a low, soft voice, and that's what she did. Sometimes it was really difficult for me to hear what she said. Rectum constipation, it is quite a very banal rubric. And then she had pain on the upper arms, and I took shoulder. Be careful when there is pain in the shoulder. Very often they point to the deltoid too. Not only so in the shoulder, I could not find viola odorata. In the deltoid problems, I could find it. To be very careful with repertorization. That's why Kent always says first repertorize on general symptoms, then go to particular. Inflammation of sinuses, you can have a lot of remedies, and then frown, disposed to frown, knitting his brows, and this was all typical what she did. When she was talking, it was as if she could move her brow into a kind of a very little triangle upwards, with the tip upwards. Wrinkled forehead I took. And then again, a very interesting rubric. When she was telling me about the divorce of the husband, I said, how was the divorce? How is the divorce developed? And she said, we understand each other, me and my ex-husband, we understand each other very well. And we do this, doctor, she says, because we don't want the children to suffer from all the quarrels. Very often there is a lot of quarrel. There is a lot of use of lawyers and so on, and they make it worse and worse, also psychologically, very, very burdensome for the children. And she said, something like this, you must try to solve in a logical way. So indeed, and this rubric was correctly used, the emotions were predominated by the intellect. So a lot of people react emotionally in such cases and continue to do this. And this is nefast very often for children. So I admire the way she and her husband could solve the problem of the divorce in a very logical way, so that the children did not have to suffer from it. So all those rubrics point to viola odorata, which is a not so well-known remedy, but which is they say it's a small remedy. There are no small remedies in homeopathy. There are only correct remedies or not correct remedies. So in this case, viola odorata is not a small remedy because it helped the woman very much. Yes, next case, please. So the repertory of Clark, I said, the temperament's the best one. I did not find the remedies in extremities, pain, shoulders, but I did find it in deltoid rheumatism. We know deltoid rheumatism, it also belongs to the shoulders. In deltoid rheumatism, we also have urtica urens and so on. We have many remedies there. Deltoid remedy, we found viola odorata there. Okay, not find. It is not, it is, can we go back? Yeah, the remedy is not, sorry, go back for a while. Yeah, the remedy is not in the repertory of sinusitis, but it is in the materia medica of Böricke. Strange enough, they all call it a synthetic repertory. There is nothing synthetic in the repertory. The only thing we can rely on is the materia medica. That's all. So viola odorata. I think I found viola odorata. Acts upon frontal sinuses in Böricke. Look, you rheumatoid deltoid muscle, indeed. And then we can go up again in, yeah, you see, acts upon frontal sinuses. Look there, acts upon frontal sinuses. It's the last, almost the last sentence. So you see here, we don't find viola odorata in the rubrics of the repertory. Be careful, the repertory has not the last word. The last word has the materia america, not the repertory. So viola odorata indeed works on sinusitis too, and it is not written in the repertory, in the so-called complete repertory. No repertory is complete. Yes, we can go back to the slide, please. Okay, yes, done. So I gave viola odorata every morning in a 4C. What did I do? I have enough experience with this. When you have calcification of the rotator cuff, please add solanum malacoxylon in a very low potency. Give it once a day or twice a day, whatever. And after a few months, you will see the calcification disappears from the tendons. A very, very strong, important remedy. An organotropic remedy, solanum malacoxylon. It is found somewhere in South America, I think, where cattle or sheep eating this stuff developed exostosis like eclalava-like remedy. But solanum malacoxylon, very typical for calcification of the rotator cuff of the shoulder. And then I also added, because miasmatically, I added tuberculinum residuum because the tubercular influence was very strong also in the she had the tuberculosis also. So I prescribed a remedy which was indicated for repertorization, viola odorata. I added an organotropic remedy for the shoulder problem, and I did not forget the miasmatic remedy, tuberculinum residuum. Now you can say, what will happen if you don't prescribe tuberculinum residuum? Well, be careful. If you don't prepare the remedy, when you have a good, correctly prescribed remedy like viola odorata, and you do not prepare the organism to get rid of his toxins, be careful with aggravations. So in this case, like Hahnemann did, he started many chronic cases with sulfur. I tried to follow Hahnemann a little bit and say, why should I not give also the miasmatic remedy to prevent the fact that otherwise maybe the tubercular miasma blocks my work, the action of viola odorata. That was my reasoning. Okay, so the follow-up in September, then she develops mastopathia for the first time. For the first time, she develops reclus disease. And I have no time to explain everything, but for this, I very often give folliculinum. And one dose on the 10th day of the cycle of 7C. So folliculinum, I have very good effects in certain hyperfolliculinemia stages, but it's quite, you very often see premenstrual tension and so on. And very often those people who need folliculinum, very often they feel their ovulation, or they have problems around the period of ovulation. So on the 11th of October, the shoulder is totally healed. I mean, no pain anymore. The pain is totally gone. She can, the mobility of the shoulder is very, very good. And she still has the cysts, the fibrocystic problems of the mommy, but the reclus is also better. And she does not feel, I do not feel my ovulation anymore, she said. And the stool is okay too. So she has a very good reaction on those 3 remedies. I have no problems with prescribing those 3 remedies. It is real classical Hahnemannian homeopathy. It has nothing to do with polypharmacy, not at all. Very often, one remedy in such chronic cases, as you will see, is not enough. Do not hesitate. Read the books of Burnett, like Burnett. Burnett was very successful. He very often had intercurrent remedy. Also Hahnemann himself, Bunninghausen. When necessary, they alternated remedies. Don't stare yourself blind at one constitutional remedy, because it will only give you frustration. Okay, then we have the follow-up now, or this, okay. Oh, this is also an interesting case where miasmatics can become very, very interesting. A woman born in 74. And I treated her family when I started my allopathic practice in 77. And I remember her father came in for the first time in my office. I still see him coming in my imagination. And he went to a gastroenterologist And that guy said, the problem with your anus is that you have hemorrhoids. But the guy came in, the patient came in. And as we know, after hemorrhoids, a tumor can be hidden too, especially in very psychotic people, everything is hidden. So I did a palpatio per annum and I found a huge tumor, almost inoperable in his rectum. And he died a few months later after operation. But so I was a physician, allopathic physician for the family. So I knew the uncles, the aunts, and a very strong multi-miasmatic loaded family. A lot of cancers, strokes, heart failures, even incest. Even incest. It's very syphilitic, very syphilitic. So, and then the woman comes in July the 19th, and she asked me about the father. And she says, Doctor, I remember that you were an allopathic physician. Can you tell me things about him? And she became very sad. Okay, I said your father was a very calm man, a very nice man, and so on. And I told her about the father, and it seems to console her a little bit. So she was too young then to know her father. She does not remember him, but I could help him with. I could help her with telling things about him. So, 2017, they diagnosed rheumatoid arthritis in this woman. In 2020, she had a tonsillectomy. In 2020, she also has a tympanoplastia of the eardrum. I know the mother is schizophrenic, she's in psychiatry. There was incest in that family and so on. And this woman with rheumatoid arthritis, she took levetiracetam 7 milligrams per week, but she stopped it. She stopped the levetiracetam. She said, I cannot tolerate anymore, and I want you to try to help me with homeopathy. So I will do my best. She has fibroma of the uterus and 2 cysts in both mammae. And then she told me something very, very interesting. She said, after taking levetiracetam, there was a swelling of my right calf. And when you hear such a side effect of an allopathic remedy, it becomes homeopathically very, very interesting as a starting rubric. Very interesting. Every side effect, because every person reacts individually to allopathy. And that individual reaction is a homeopathic expression, is a homeopathic symptom, because it's individual, it is idiosyncrasia. We see this very often. For instance, what kind of people develop rhabdomyolysis after treating cholesterol with statins? The syphilitic people. The syphilitic people do. A psychotic person will not, a psoric person will not. The syphilitic patient reacts in that way. And there already you see a hint to the miasma. I remember a case of a woman who had, after Primperan, metoclopramide, the anti-emetic, the allopathic drug, Primperan, she developed a kind of oculogyre crisis, a kind of epileptiform crisis with a lot of twitching and distortion of the face and so on. This woman has prognatism. This is a sign. This happens in syphilitic. So syphilitic, miasmatic, loaded people react very intensively to side effects of homeopathic remedies, very often. You see also in diseases, in what kind of miasmatic person do you see Sudeck atrophia, algoneurodystrophia? In syphilitic persons, in syphilitic, just the same. Okay, we can go on. The next slide, please. And she has a lot of grief because of her father and so on, and she is perfectionist. She said, I have to look at things in a different way because I push all bad things away. It's a psychotic way of getting rid of things. I don't think of it anymore. It's finished and so on, but it keeps on in your organism. It keeps on doing retaliation in your organism. Difficult to fall asleep. Good stable relationship with the husband. Her husband is a very successful businessman. Sensitive to moist weather. Okay, psychotic, hates the cold winter months. Offensive perspiration of the feet. Spotted nails. Makes us think of silicea. A lot of otitis as a child also makes us think of silicea, and even later, because at the adult age, there has to do a tympanoplastia. Indented tongue. Indented tongue is mostly, not always, but mostly a syphilitic stigma, syphilitic symptom. does not like to speak before an audience. Again, we think of silicea. Sleeps on the right side. And then diarrhea, something about the mummy, I cannot exactly see. Yeah. Diarrhea during menses. Diarrhea during menses, think of Movista immediately. Oh, brother contracted tuberculosis as a puber in his puberty, and I knew his brother very well. He was a very strange guy, a very nice-looking, very good-looking fellow, nice-looking guy, but from a very special psychical attitude. So he was very shy, very sensitive, very shy, a loner mostly. And then also the woman herself, she had a positive Mantoux in childhood. Sensitive to drafts also. And then I asked her, can you tell me something about your dreams? And then she said, what I often dream is, dreams can be very important. What I often dream is, she said, I often dream that I must shriek, but I cannot. It is so frightening. So the feeling, and then we look at the photo of the first finger, of the index, and we see the proximal interphalangeal joint is quite swollen, Yeah. Okay. We do a repertorization. So what do we? This is a very interesting rubric. Yeah? We have to dreams, unsuccessful efforts to shriek. This is so important. I saw it many times. A very, very important rubric we can use in cat. Teeth caries already as a child. And then, as I said, what was the side effect? The side effect of ledetrexat with her was the swelling of the calf. We can use it. We can use it as a homeopathic symptom. Every side effect of an allopathic remedy has a miasmatic and a homeopathic significance, very, very strong. Diarrhea during menses. We all know that silicea mostly has obstipation during menses, but also it can have diarrhea during menses. So the first remedy I thought of here was silicea. Yes. Next slide, please. So I gave her silicea 9C every week. Tuberculinum residuum. Why residuum? Again, when you need a tubercular nosode in a rheumatoid case, in a problem with joints, use residuum. 15C every 3 weeks. And I also used Berberis vulgaris once a day to make the elimination more efficient by kidneys and liver. So we see the proximal interphalangeal joint of the right index, stiff finger, painful, swollen, hands very stiff, painful in the morning. Yes, okay. Then we go to the next slide. So next consultation, October 4. So rheumatoid arthritis in a very strong miasmatically loaded family. If that is not a paragraph 40 example, then I do not understand the organ. This is very typical. She had a very, very good result. On the 9th of August, the morning stiffness was better, the sleep was better. On the 7th of September, she tells me that the sun has a very good effect on the pain. When people tell you this, that the sun has a very good effect on the pain in rheumatoid problems, immediately think of strontium carbonicum. Immediately. This is a signature of strontium carbonicum. She is much better in summer. Pain on the right ankle is already better. I gave a strontium carbonicum 7C 3 times a day. And then today, on the 4th of October, the strontium carbonicum did a wonderful job that I added it. I did not skip the other remedies that I was treating. No, I don't do this. I just added strontium carbonicum and she has a very good reaction. You see the photo now, the proximal interphalangeal joint of the first finger is much less swollen, and she almost has no pain anymore. Because that was a problem, that monoarticular disease she had was the problem. The finger is very good. So the photo, no pain anymore, swelling less. Now she has pain in the right arm, she's known for a clue. And then I also give her a dose of folliculinum, 1M. And then they ask me also, sometimes they ask me during my lectures, why did you give that potency? I said, because I had no other potency at my disposal. So that's the only reason. Okay, so a very good reaction. So you see do not forget, you see very often in a case, you need a symptomatic remedy. You need a miasmatic remedy. Sometimes you need an organotropic remedy, and you can need a remedy that helps the organism to get rid of toxins. And Berberis vulgaris is a wonderful remedy, and it's just adding remedy you can add in cases where toxins has to be eliminated via kidneys and liver. And if you don't do that, very often instead of results, you have aggravations. That's my experience in it. Okay, and maybe now we can end with the last case, which can also be, maybe be very interesting. The case of that boy with, that's it. So this child has a kind of impetigo-like disease, eczema also. Also had problems with running air, with you see the eczema, the impetigo-like eczema of his skin, and also a problem with chronic catarrh of his middle ear and rupture of the tympanum and discharge of pus and so on chronically. So when you look at the child, the first impression I had when I look at the child, this is a calcarea child, a type of calcarea child. But then I looked at the knees. Can we show the photo of the knees? And so very strong knock knees, Genua valga, very strong Genua valga, which we also can see in calcarea children, of course. We can see that. But this made me think of another remedy I once read about in Burnett, I think. It was in Burnett, or maybe in Allen also, I think. So I went to the repertory of Clark, and I said by myself, I have to look for this. This is very strong. Clark, yes, you have it. Okay, Clark, knock knee. And Clark emphasizes malandrinum here very much. Emphasizes malandrinum very, very much as knock knee. We will see Clark, clinical, knock knee, knock knee. Yeah, knock knee, see? Knock knee, malandrinum. What is malandrinum in fact? Malandrinum is, I think it is made from the grease of the horse. Something that is extracted from the hoof of the feet of the horse. I do not exactly, but malandrinum, I know it is very important after. It can be very important after vaccination. It is a vaccinosis remedy very much. So it means it is a psychotic remedy. It means psychotic, and you don't have problems here when you look at the child. You don't have problems to categorize him in the psychotic miasma when you look at him. Quite a psychotic-looking child. Malandrinum, indeed, vaccination and so on, right? Okay, so we can go back to the slides. Okay, so I gave malandrinum 200C. It was the only thing I had here, 1 doses, and then we look again at the. Okay, so can look at the follow-up somewhere. Yeah, so you see the impetigo almost disappeared and left a little apigmented zone like this. But he had a very good reaction on malandrinum, and also the ear problem started to give him problems. The chronic ear problem was also much better. Next slide, please. Yes. So the mother is very happy with the result. Last dose malandrinum, 200 was 5 weeks ago, doing very well. Only some residual spots on right leg. All other dermatitis cases, eczema disappeared. On his back, a lesion deprived from pigmentation remains. Father is from Nepal. I even see slight improvements of Genova valga, but maybe I was a little bit too optimistic. I cannot see this, not say it objectively. I had the impression that was better. We will see when he grows up. So this is a case of, do we still have enough? Yeah, okay. Yeah. So you see, it's very good healed. The eczema case, impetigo cases, it looks very good. Yeah. Okay. Yes. So this is a case of malandrinum. Just to let you know that we do not know a lot of remedies well enough. In fact, we don't know any remedy well enough, because I think when you get the age of 400 years old, even homeopathy is still difficult then. But a little used remedy, malandrinum, can become a polycrest suddenly. We should avoid to concentrate only on polycrests. There are so many remedies. There is a reason why there are so many remedies in the repertoire of Berge or in the materia media of Berge. They all have their significance. And once in a while you will meet a small remedy, and then suddenly it's not a small remedy anymore. It is a polycrest. So I think my time is over now. And I want to thank you all very, very, very much for your attention. For all the people who helped me, Dr. Manjari, Dr. Anna Danilova, thank you very, very much. And especially, it was really my pleasure and honor to teach for all of you. And I really enjoyed it. Thank you very much. Thank you. The only problem is time, lack of time. Thank you very much for Manjari and Anna. Thank you very much for helping me. So I don't know how we go on now. Maybe Manjari will tell me what has to be done.
Thank you so much, Dr. Eddie. Oh my God, this was an extremely engaging and highly intellectually loaded webinar. I mean, there's just so much information, so much understanding, so many concepts that you granted us that we have enough food for thought for the next few weeks at least. Would you like to take some questions, Dr. Eddie?
Sure.
Yeah. So,
I hope I can answer them, but I always like them, but I hope I can answer them too.
so
Maybe they can stop screen sharing. Maybe we can have Dr. Eddie there for the, yeah.
Thank you very much for all of you.
So when you were discussing the miasms, that time Dr. Kamlesh asked a question that you said for tubercular miasm that they can be emotionally strong and also fragile. So would you like to clarify that aspect of tubercular miasm?
Sure. So I mean, tuberculinum, people with tubercular miasma have very strong emotions, and they hate routinism. They like change in their life. They are so they want something. They want to do something special, something artistic. They are very passionate people, passionate in their life, in their love life, in everything, in the work. They are very passionate. They don't take things for granted. They're very passionate people, and that is why the big artists in music, in painting art, in whatever, very often have an active tubercular miasma. The typical example for what happened in the time of tuberculosis, for instance, suppose we had a situation where the daughter of an aristocrat fell in love with a guy who took care of the stables of the horses. So it was impossible. She could not. She was forbidden to fall in love with that guy, but she loved him very much. But it was forbidden. The guy has no ranks enough. He has no status enough to marry her. He's just an umpire, just a working man. It's a servant. So what happened? In that case, the woman loved that guy so much that she isolated herself. She went to her bedroom. She didn't eat anymore. She didn't drink anymore. And she totally became sick, and she contracted in that time tuberculosis. Tuberculosis was her way of saying, I don't want to stay in this life anymore. I have enough. If I cannot love the person I really love, I don't want to live anymore. That's a very sad situation. So that's we call the love out of social context. Falling in love out of social context can lead people in such a situation because the emotions are so strong. They are not longing for things; they are yearning for things. It's one stage higher. They're so passionate people. They're also very interesting people as a company. They know so many things. They are interested in many things. They are artistically very, very, very good in every way. So indeed, it is strong emotions and not emotionally strong. Indeed, that is right. That's more. They are strong, very strong emotion. But thanks to tuberculosis or the tubercular miasma, we have so many arts. And as you see, for instance, in literature, when the tuberculosis disease was more and more conquered by tuberculosis statica, the romanticism disappeared gradually in literature too. So you see those things going together. So tubercular miasma is a very, very interesting miasma, and we still see daily. We see the sequelae of this miasma nowadays, and it continues for many, many years. And that's very, very interesting about tubercular miasma. So very strong, passionate people. Whatever they do, they're passionate in it.
Okay.
And I can give my own example. My grandfather died from tuberculosis in the Second World War when he was 39 years old. And tubercular miasma is a trait that goes on in my family, from me to my son to my grandson. Wherever you see it, very often you see tubercular traits in it. Very, very interesting topic to study. You can, I think, Coulter wrote many interesting things about Coulter. You know, Coulter, the homeopath, wrote many interesting things about the miasma stuff. Okay.
So, Dr. Ritu, our co-host for the evening, is asking us, isn't Natramur also applicable in the same situation as tuberculinum, as you mentioned, with that girl who was in love?
Yeah, about natrium muriaticum. Yeah. Natrium muriaticum.
Is it also applicable?
Yeah, natrium muriaticum very often belongs to the tubercular miasma, really. And what we see, for instance, I'm going to give you an example. And recently I had a case like this too. It was a child with fever, and the mother gave, I cannot not recall exactly, but the result was that next day the fever was 39, and next day it was 34.9. So hypothermia. And in that cases, I learned this from the French homeopath, Dr. Vanier, the late Vanier. He already died many years ago. I read in his books. In that case, you of course the hypothermia is not so good too. He has to come to a normal body temperature again. And in that case, for instance, you can give tuberculinum marborek together with natrium muriaticum. Natrium muriaticum is very often associated, what is very often associated with especially the oxygenoid, the syphilitic tubercular remedy, the marborek, very interesting. So I know we all learned from Kent tuberculinum bovinum, but we should study tuberculinum Koch, marborek, Dennis, and aviare too. The tuberculinum Dennis is especially suited to psychotic people, to plethoric people. So when you have to prescribe tuberculinum to a really plethoric person, prescribe tuberculinum Dennis. Dennis is the name, I think, of a Belgian homeopath who once investigated it, did investigations in that thing. Tuberculinums are so, every nosode is interesting. If you see what malandrinum can do, but tuberculinum is, we should use it more and more and more often. We don't use it enough. We don't use nosodes enough. That was also a success of Dr. Burnett. Yeah, Dr. Burnett, he used nosodes. For instance, when there was an history of very bad measles, he prescribed morbillinum in between. If you don't do this, you will not get rid of that layer. You have to, when there is a bad situation of measles in the childhood, it can still hinder your result on your correct prescribed remedy nowadays, even if it's 20, 30, 40 years ago. Still, you can need morbillinum now without having measles or without having anything to do about measles, because you had it in the past and it was not really correctly treated. Because we know that every acute that is not correctly treated will very often go away, but manifest himself in another location of the body. And that is the definition of psora. That's what psora means, the alternation from one to the other. And that we can also call it metastasis. We can also call it metastasis. It goes from one into the other symptom. Okay?
Then we have another question from Dr. Vanita. She's asking, what are the specific indications of Spigelia in diverticulosis?
Spigelia in?
Yeah, in diverticulosis.
Diverticulosis, okay. So maybe Anna can help maybe with the repertoire of FATAC. In FATAC, we have a rubric. In FATAC, we have a rubric sitting down, I think, sitting, yes. Sitting down, first sitting down, that's it. Look, aggravates. We have ammonium muriaticum, antimonium tartaricum, and Spigelia. Now, what I found, maybe I have 5, 6, or 7, or maybe more, I don't know, people with diverticulosis and diverticulitis. What I found out, that all those people, all those persons told me that they had serious pain in the abdomen on the act of sitting down. When they sat down for a while, it was over, but on the act of sitting down, it was painful. And that made me think of Spigelia, maybe together with a few other. And then I saw the importance of Spigelia in diverticulosis. And now immediately, when I have a patient with diverticulosis, diverticulitis, I immediately think of Spigelia, and I had very good results with it. And it was, like I said, confirmed by old literature from Allen and from another guy I forgot. That's a very important homeopath. But like I said, Spigelia is a very interesting remedy. Of course, that's we should say, yes, we have to treat individual on individual basis in homeopathy. But the more we get experienced in homeopathy, the more we see common things coming up. We see, for instance, in narcolepsia, very often immediately we think of Laurocerasus in narcolepsia. In narcolepsia, in women, after weaning, for instance, they fall asleep when they're standing, we think of Philandrium. So it is not forbidden to think of remedies that often occur in certain pathological conditions. It is not against the idiosyncrasy or against the individuality of homeopathy. You have to take them together. We must think very flexible, very flexible. And so weaning, especially I think Philandrium, especially sleepiness overpowering, I think, because Philandrium women fall asleep while standing. Sleepiness overpowering, maybe, yeah, like Nux moscata also there. Philandrium must be there. If it's not there, don't care about it, but is there Philandrium? If it's not there, so again, I'm going to tell you something, maybe if you allow me, about additions. We know that there is a certain repertory. I think the weight is 5 kilograms. So don't trust this. Just don't trust every addition in the repertory. Addition is very often made by people who do not see or who do not realize that a patient is very often in the transition of one remedy into the other. For instance, I see many cases of sepia with ecchymosis of the skin. Let's look at the rubric in Schoen synthesis, ecchymosis of skin. You will see sepia is not there. Ecchymosis. Sepia is not there. So, does it mean that I have to go away from sepia because the woman says, yes, I have very easily bruised spots, ecchymosis. Do I have to go away here? No, from sepia, not at all. If we have arguments enough for sepia, we prescribe it. On the other hand, are we allowed to make an additional sepia here? No, we do not. And that is the big mistake that is made. And that gives us those huge repertories, which are so confusing that we cannot use them anymore. It's too big. It's too big. It's not reliable anymore. Too big repertories. But it means that, for instance, the woman is in a transition of going from phosphorus to sepia. And then we must realize that this sepia woman has maybe enough phosphorus symptoms from the remedy before that it is still there. That's how we have to think. We see that many patients do not present themselves in only one remedy, but very often are in transition from one remedy to another. from lachesis to sepia, from sepia back to lachesis. And then they say, yes, okay, here I had a sepia, I treated successfully a patient with sepia who had ecchymosis on the skin, so I'm going to make an addition on this ruby. Totally wrong. You create only repertories that confuse you even more and more. Okay, yes.
All right. If there are any more questions, you can put them down on the chat, or else then we go ahead. Dr. Ritu. Thank you so much, so much. This was not only enlightening, but also mind-blowing and belief-shattering because of aggravations, totality, so many concepts that you have actually broken down into simplistic angle that as homeopaths, I think the key, most important thing for us would be to keep our minds open.
Yeah, that's true. That's true. Or eyes and our minds.
Eyes and minds.
But I thank you all again. I'm very honored that I could do this for all of you, and I'm very happy with all of you too, for your attention and your help. Thank you very, very much. Pleasure is all mine.
Thank you so much.
Thank you, sir.
So I would like to tell you, Dr. Eddie, that the fact that we are actually sitting here in Dubai, in the Middle East, and practicing homeopathy has happened due to the efforts of one man. And I think we have him here, don't we? Dr. Sasan, please, can you unmute yourself? And
I have to unmute myself. Yes, okay.
so, Dr. Sasan, no, you have to keep yourself unmuted. Dr. Sasan has been solely responsible for running pillar to post and putting all aspects together to actually make homeopathy practice possible here. So he is the one person who I think would be really happy with seeing the quality of webinar that we have had today. Dr. Sasan, if you're on board, we would like you to say a few words for today's session.
Honestly, I don't have much to say. It's an amazing experience listening to such a great speaker, knowledgeable, with experience, many years, different places. And so for that matter, the only thing I can say is really, as you mentioned, it's so good to see the quality of presentations improving. And we are every time new knowledgeable speakers you bring on board, the whole team of Homeopathy Middle East, it's really, everyone is get benefited. I don't want to talk much. I know that Dr. Motiwala was here, Farooq Motiwala. If he's around, I would like him to say something. Otherwise, I'm really, thank you so much. Thank you, Professor Eddie, for enlightening. Thank you so much. Thank you.
Thank you, Doctor.
Thank you, Dr. Sasan, and thank you, Dr. Eddie. Yes, since we have Dr. Motiwala here, I would invite Dr. Ihab to say a few words about him, and then we can have him over on board.
Thank you very much, Dr. Ritu. I am audible?
Yes, absolutely.
Thank you very much, Dr. Ritu. Today is my pleasure to introduce our special guest. And our special guest is very special for me. It's not because he was my principal, my teacher, but also his friend of mine. He's the one that shaped my future. He's the one that changed my future. When I went to India long years ago, I went to study microbiology. When I met today, our special guest is the one that convinced me to change the course from microbiology to homeopathy. The decision was so difficult at the age of 17 years old. When I shared my parents about this, the answer was no, because we don't know what is this. We don't know homeopathy. It is not available in your country. It is not available and recognized by any other Arab countries, neither in Egypt nor in Saudi. I went to Delhi and discussed to my embassy in Delhi to discuss this issue. My embassy is also refused. And they told me, you have to stop what you have been sent for. And I had to take a decision, and I took a decision against my family wishes and against my government. This today, our chief guest today, he was beside me. Our chief guest today, he is so famous and well known
Thank you, Dr. Ritu.
professors and
I'm
homeopathic
extremely honored to
physicians
extend a big
in
thank you
Maharashtra state,
to Dr.
especially in
Ritu.
Nashik. As a professor, he taught thousands of students about homeopathic, the science of homeopathic medicine. As a physician, he treats thousands of the most difficult case, incurable case successfully. He also established welfare organizations that provide help and free medical treatment to the thousands and thousands of poor people since 25 years still now. Our chief guest today is the Professor Dr. Farooq Mutiwala. He's the founders and principals of the most famous college in Maharashtra state that located in Nashik, and that called Mutiwala Homeopathic Medical College, from which I graduated. The college is provided degree courses and also PG course, medical MD in various subjects of homeopathy medicine. Dr. Mutiwala, he also established Mutiwala education that involved in several schools and several colleges as well. He has extra brain or ordinary. He also have a lot of activity and a lot of researches, and he also written various books going to publish soon. Thank you very much, sir, for accepting our invitations, and you can take over.
I'm thrilled to have a student like Yehab, and with these high regard words. Thank you, Yehab. And Dr. Eddie, it was wonderful hearing you. And really, this was the real homeopathy that we like to hear about. In the farce of classical homeopathy and in the different names of homeopathy, we hear so many other theories. But this is the straight homeopathy, which I was very thrilled to hear. And thank you for the same. You have enlightened me a lot, and I would oblige for that. I have been since 2012, I have been introduced to the Germanic new medicine of Dr. Hammer, who discovered a new principle and gave his 5 biological laws in 1978. And I was introduced to this wonderful understanding by our late Dr. Vijayakar in one of his seminars. I'm sure we are all over time, but I'm going to make it very short. What has been always intriguing me is miasms. So when, as a student, whenever my teacher tried to teach miasm, I would say, what is the cause of miasm? So if you say miasm, the fundamental cause of diseases are the 3 miasms. So my question was, what causes the miasms? And then there were different kind of answers. And the answers ranged from temperament, constitution, diathesis, and inherited from our ancestors, and so on and so forth. But I was never really satisfied. And I always looked for the answers. What causes miasms? What causes sora? What causes psychosis? What causes the syphilitic miasm? What causes the complex miasms? And it was, when during this seminar, after I heard this, I immediately rushed to Canada, where there is a small school that every year they hold these seminars on miasms. But really, they're not ready to accept homeopathy in any form over there. But I went into going deeper and deeper into this understanding. And of recent, I have come to understand a very wonderful thing. And that is, Dr. Hammer, he talks about that all the diseases are related to the 3 germ layers. that is the ectoderm, the endoderm, and the mesoderm. Very interesting. And then he goes on to describe, and we also have seen in our practice, that the ectoderm gives a set of diseases, and so does the endoderm, a set of symptoms, and a set of symptoms in mesoderm. And when we go and study this, friends, this is what I'm writing about now. And I think it's for the first time that I'm really sharing this idea of mine with anybody. And when I saw this, it is ectoderm has got functional problems. The function of the organs, the function of the glands, the function of the tissues. Endoderm is related to growth. And Dr. Hammer says cauliflower-like growths. And mesoderm is necrotic. Our ulcers, our deep ulcers. Now, what does this take you to, friends? Doesn't it take you to SORA, psychosis, and the syphilitic miasms? It is very interesting. The deeper you go, the more thrill you get. And then he goes a step further. And he says, what deranges the ectoderm are conflicts in our life. Very interesting, conflicts. Yes, we go through conflicts every time in our office, but we resolve the conflicts many times right away. But some conflicts do not get resolved. So conflicts related to ectoderm are very specific. Conflicts related to endoderm are very specific. And conflicts related to mesoderm are very specific. So what are they? Conflicts related to the ectoderm, which now I'm terming as, are activated by separation conflicts. Now, separation can be so many different kinds of separations. Separation, intellectual separation, separation from your loved one, separation. A child is born and immediately taken from the mother and taken for phototherapy. And they say, no, the child has to be in the phototherapy for a few hours. And friends, this is the separation conflict. And the child comes down with eczema, comes down with psoriasis, comes down with so many different diseases. So separation conflict is related to the ectoderm. The endoderm is the morsel conflict. Dr. Hammer says is the morsel conflict. Endoderm is everything from the mouth to the anus. And the morsel, once it goes into the mouth, is the projects you go through in your life, are the undertakings in your life, are the relations in your life, your projects, whatever you are undertaking in your life, how they go through in your life, where they get stuck, where the difficulty comes, is what causes your endoderm or the psychotic miasm to be activated. Now, you see, like Dr. Hammer says, stomach is an indigestible anger conflict. So when a patient comes to you with ulcers, you know this is where I'm going. So you ask him, what is your anger conflict? And they have forgotten. You have to go back. There are so many cases I would like to talk about, but I know I don't know how much time I have got. Dr. Ritu, and please let me know whenever you want me to stop, yeah. I'll stop.
Please, please, Dr. Motiwala, you continue. We have another 10 minutes. Probably you can just talk on it.
Okay, I think I'll try to wind up in 10 minutes.
Yeah,
sure.
Yeah. 10 to 15 minutes. We are extending, but that's okay.
Yeah, and then comes your mesoderm. The mesoderm is part of the whole musculature, the whole circulatory system, the whole muscle system of your body, and the bones. The whole skeletal system is formed by the mesoderm. And what affects the mesoderm? Very interesting. It is the self-devaluation conflict and insult. One brings down his own values. One thinks, I am no good anymore. I cannot do it anymore. Or someone has insulted him. Someone a child in the class, you know, we remember a generation before us, before my generation, you people are a lot of the young people over here. There were the insults in the classroom was very common. It was very simple. And we didn't realize that what kind of effect it can have on your constitution of the child. And this is where the syphilitic miasm comes in, a self-devaluation conflict. And you know, you can understand that having one disease like psoriasis will automatically lead to insults, will lead to the person feeling, depressed, the person feeling ugly, I'm looking ugly, and he goes into the next miasm. So friends, this is very interesting. And and what Dr. Hammer says, the miasm needs, the conflict needs to be resolved. And now with the nuclear families coming up, you don't have people to talk to. You need to downgrade your conflict. So downgrading the conflict is a very important aspect of healing. Now coming to diabetes. I was just preparing last night on when I was told that we are going to look at the miasm of diabetes. Dr. Hammer says that every disease is not really a disease. He calls it a special biological significant program being run by your body. So these symptoms that are coming up is actually trying to defend your body, is trying to reinforce your body. And this reinforcement can be in the form of bringing down of some functions, increasing the function, proliferation of the cells, or even necrosis of the cells. So this is very interesting for you to see that he terms it as a special biological significant program. Now, what happens actually in diabetes? In diabetes, this biological significant program calls for excess of fuel, which comes in the form of sugar. And now when do you need this excess fuel? When do you need this excess of sugar, which is the food for your brain? Is when you are going through resistance. When you are swimming against the current, or you're going against the current and you are facing resistance. Now in males and females, it is seen that the conflicts are different. In the females, if they have diabetes, it is out of a disgust conflict, a fright conflict, a fear conflict. And if it is coming up in the males, it is a resistance conflict. It is something that he is trying to resist, or he is being forced to do something against his will, or in his office. He carries this thought, his work home, and the need for the sugar is more and more, and that is why your sugar goes up. So now you need to resolve the conflict rather than just fight the sugar. So you see, friends, it is very interesting that we need to try to understand. Now it's a very lengthy understanding of the 5 biological laws that Dr. Hammer talks about. As Dr. Eddy was saying, one remedy, there's a transition into another remedy. This is how Dr. Hammer's principle of the law of conflictolysis. He says you have a set of symptoms in the conflict active phase, and then you have 2 sets of symptoms in the conflictolysis phase. The conflictolysis phase, or the healing phase, goes through 2 stages, through 2 phases. And between these 2 phases is the phase of healing crisis. Dr. Hammer calls it epileptoid crisis. And this epileptoid crisis is in between 2 healing phases, phase A and phase B. And many a times in the epileptoid crisis, we lose a patient. A myocardial infarction or a brain stroke is a very good example of an epileptoid crisis. So when we are going from conflict active to a conflictolysis phases, our remedy is bound to change, that we were seeing so wonderfully explained in Dr. Eddie's today's talk, how he went from one remedy to the next remedy. And I was thrilled that here we are really understanding, we need to understand that when the patient goes from conflict active to conflictolysis, and conflictolysis to the final stage of healing after the crisis, the healing crisis. I'm going to go to one more point, and then I will stop here. And that is understanding that the conflict active phase has got very clear symptoms. If Dr. Ehab always remembers, whenever I see patient, I always hold their hand. And people wonder why I'm doing that. And then I don't care if it is an elderly person or a young person. I always have my hand and just try to feel it. And it was in 2012 when I read about Dr. Hammer's theory, I really understood what I was looking for. In the conflict active phase, you will find the palms of your patient to be cold. This is a very, very interesting thing. There are 7 other features that I have identified in a conflict active phase. And if your patient who has come to you is now in a phase of healing, you will find warmth in his hand. So your application of the remedy changes. Your potency of the remedy changes. So friends, this is one very interesting thing that, you literally can know whether your patient is in a conflict active phase or in a phase of conflictolysis. And you can exactly tell what has happened in their life. You hold their hand and you tell them, tell me what happened with your mother. Why are you angry with your mother? Why are you sad with your brother? If you understand GNM, you become an astrologer. Patient asks me, doctor, why did you ask me directly this question? And I said, this is what your symptoms tell me. So friends, this is just a brief, a teaser into GNM. And I hope sometime we can go into much more details. These are usually 6-day seminars, and they go to the whole length of the disease understanding. And for us homeopaths, I tell you, this completes our homeopathy. This completes our understanding of miasms. And then we go and select the medicine. Your case taking, this is your key to your case taking. It is the master key. After everything is said and done, you have heard the patient, now go and tell him, okay, so in this case, this should be the conflict. So if it is right-sided or left-sided, depending on the symptoms, you can directly ask him what has happened with your partner, what has happened with your business, what has happened with your colleagues, your children, your siblings, and you can complete your case and get the key to your final remedy. So like I was, I think I'll stop here, friends. I'm sure there are, I would have loved to get questions if you have any. And from Ehab. So on WhatsApp, you can always send me your questions and I try to answer them. If we have time over here also, I'm fine, Dr. Ritu, if people would like.
In fact, if anybody has any questions or anything to talk about Dr. Motiwala or ask him anything, you're most welcome to ask. Please, we have time because we are privileged to have Dr. Motiwala on this platform today. It's a very welcome surprise for all of us. So any questions from anyone, you can either raise your hands or put in the chat box. Otherwise, whenever you have any query, probably you can get in touch with Dr. Ehab, and he's the best person for coming. Okay, Dr. Santosh wants to ask some question. So Dr. Santosh, can you please unmute yourself?
Yes. Good evening, Dr. Eddy and Dr. Motiwala.
Good evening.
We are so delightful to be you along with us because I am a predictive homeopath. Whatever you told is absolutely correct. We can predict the name of predictive homeopathy, which Dr. Praful Vijayagar put. It's GNM, sir. through GNM, we can predict what is
Yes.
going to happen to that particular person next. With GNM, whatever you told, 3 miasms, it's absolutely correct. We all of us should study GNM, and we would like to have you along with us for several sessions of GNM. Thank you, sir. Thank you very much for your talk. Thank you. Thank you.
Thank you very much.
Dr. Ihab, would you like to say something?
Very much. Nothing I have to say.
Regarding
Thank
this
you very much, sir. It was wonderful. Very wonderful presentation by Dr. Eidi. Was learning experience. And for my principal, actually, when he talks, he reminds me college time. He keep on talking for 3 hours non-stop.
We can see you engrossed in his talk. Definitely, we can see that you're totally lost.
Okay, thank you very much,
Okay.
sir. And definitely, we'll meet again.
Sure.
Okay. Thank you, Dr. Motiwala, and thank you, Dr. Ihab, for bringing him over. I would now request Dr. Kamal to give the vote of thanks as we end towards our webinar. Can you unmute yourself, please?
Thank you, Dr. Ritu.
Yeah, please go ahead.
I'm extremely honored to extend a big thank you to Dr. Eddie Thielens for shining an illuminating light on the miasmatic approach in the treatment of diabetes and the other chronic illnesses, and also for sharing such interesting cases with such excellent results. It was indeed a very informative and enlightening session, and I'm sure we have all had great takeaways from this session. Thank you, Dr. Eddie. I would also like to thank our special guest, Professor Dr. Farooq Motiwala, for accepting our invitation on such a short notice to be part of this webinar and enriching us with your wealth of knowledge. Thank you, Dr. Ihab, for bringing him on board our webinar. Additionally, I would like to thank Dr. Manjari Rao for assisting us through the session and being a great moderator. A very special thank you to her for also arranging the extremely knowledgeable speaker of today. And a big thank you to Dr. Sasan and Dr. Amit Habbu for sparing their valuable time to attend this webinar. And of course, thank you to you, the doctors from Moscow, India, Abu Dhabi, Dubai, Qatar, Bahrain, Oman, and all the participants for listening so enthusiastically and for your continual involvement in this session. I would also like to thank the talented team of HME, without whom this session would not have been possible. Lastly, a very special thank you to Dr. Ritu, who is always working tirelessly and enthusiastically to coordinate the sessions and organize these webinars. Thank you, Dr. Ritu, and over to you.
Ritu, you need to unmute yourself.
I'm so sorry. Okay, I think Dr. Kamil also, a special thank you to him as well, because he's tirelessly joining every time taking out time out of his busy schedule. And with this, we will wind up. And I think the hammers theory mentioned by Dr. Motiwala, that is something which is really of significance. And maybe we can take it up in one of our lectures later. And of course, the enlightening remedies like Voila, Oridata, and Solanum Molaxcolinum. Okay, sorry, by Dr. Eddie. They were kind of eye openers for us. And we look forward to more sessions with Dr. Eddie, which, this was just a starting point, as we had discussed before. Now we all know, we've tasted Dr. Eddie's lectures. We look forward to many more, and maybe a series or a workshop, which will enlighten us with more information, not only miasmatic, but different aspects. Right, Dr. Manjari? I think we need to go for more sessions like that. And maybe Dr. Motiwala, if we can have him also as a lecturer, as he said, it's a series of lectures that he conducts. It will be really nice if we can have more sessions with Dr. Motiwala and have Hammer's theory also, which is a new concept altogether. So with this, I think we had a good celebration of World Diabetes Day. So I think we really marked that. Most of us we've been part of it for a long time. I think this time we had a great number of participants, almost crossing 80, which was a good, venture this time. So, and the level of lectures and everything was extremely good. So we are all very happy with the progress HME is making towards a further direction in promoting and educating everyone. We also have our YouTube channel for doctors who are new joining or any other people who are not aware of it. So all our lectures and all the events which we are conducting every time, they are uploaded on Homeopathy Middle East YouTube channel. So once you subscribe to that, you'll be able to view all the recordings at leisure. So some of them who are not able to attend at that time and they are, missing out on it, they can get back to it at any point of time. And with this, the next seminar, probably we would not be having it in December since it's a holiday time for here in UAE. So maybe we'll touch base with everyone in January. And let's see if we are able to do it virtual. If not, then of course, Zoom platform is there. And Dr. Sasan, special thank you for staying till the end. We are really grateful. He had to leave in between, but I think because of the traffic, thanks to the traffic that he had to get back to the seminar. So we had him till the end of the session. Right, Dr. Sasan? Okay.
I would just like to add one small sentence. Today's session was so impactful. It was truly earth-shattering. We, in fact, had a 6.3 earthquake close by in Iran, and we all felt it here. Yes.
Oh. Thanks for telling us.
Truly earth-shattering.
Okay. So with this, we wind up our session. And thank you all for being there. See you next time.
Thank you.
Thank you very much.
Okay.
Thank you, Dr. Ritu, and thank you all.
Thank you, Dr.
Thank you. Bye-bye. Bye-bye.
All right. Bye-bye.
Thank you.
Good day.
Thank you.
Thank you.
Thank you very much, all of you. It was my pleasure and honor. Thank you. Thank you very much.
Thank you, Dr. Eddy. Thank you,
Okay.
Dr. Motilal.
Great session, Doctor.
Thank you.
Thank you, Manjari, very much. Dr. Manjari.
Thank you.